Good to go, Kate?
Yes, we're good to go.
Okay, thanks. We'll call the meeting to order for the Community Development Committee for February the 10th. Attendance has been taken.
Yes.
Could I have a motion for approval of the agenda, please? Moved by Tim. Do I have a seconder?
Yeah, second, Greg Erickson.
Okay, second by Greg Erickson. All those in favor?
Aye.
Contrary minded, if any? Motion carried. Do we have any conflicts of interest on today's agenda with anyone? Hearing none, we're good. Okay, we'll get right into discussion with Oromocto Area Food Bank, and we'll call on Jane Buckley, the Executive Director.
Good afternoon, everyone. Thank you for this opportunity to speak in front of this wonderful group of people. I'm here representing the Oromocto Area Food Bank. And I believe I'm here to talk about kind of what the food bank does in the region, what we support, and what we're doing with the very generous donation we received just last month. So the whole thing started with a conversation, and then it ended with me putting in a proposal to this organization to purchase a new truck and some refrigeration equipment, excuse me, that we desperately needed. Because after Christmas, we have launched soft launch at this point, a new program at the food bank that was going to require us to do a lot more deliveries and driving and cooking and preserving and all that kind of stuff. So historically, the Oromocto Food Bank has been reclaiming food for the last probably 8 or 9 years. And in 1 year, we probably reclaim over 1 million pounds of food, which turns into like twice or three or whatever the calculation is for methane gas that we save from the landfill. And that food we reprocess in our kitchen and we cook with it, or we preserve it, or we freeze it, or we do whatever. So we had all this food coming, huge amounts of it. And we sit around and we think, what do we do with this food? So we make lunches for schools and kids and things like that, but we weren't making great use of the kitchen facilities to do that because a lot of that was cold food that they wanted. But I was more interested in beginning this trend with the hot food program, which is why I needed the refrigeration unit and which is why I needed a new truck, because I need to be able to drive around and deliver this food. So what we decided to do was kind of look into what we had coming in, which was what food donations we were getting and what we had to buy and what we had to have. And looking at our boxes and realizing that the nutritional value of the content of the boxes was lessening each month by what we were putting in the boxes. Because the donations were down, the money donations were down, all these things were down, and we didn't have the money or the donations to cover what we were losing in the boxes. As of this week, I think, or even last month, the price of food has gone up 22% in the last 3 years, which is a huge amount of money. And we have people out there in the world that are paying half of their income for rent, where the norm used to be 30% would be the maximum that you would pay for your housing. You would usually have 25 to 30% to pay for your food, and then there'd be another percentage for your bills and things like that. What we're finding also now in our small communities that we're working with, people who have to rent are paying closer to 80% of their income on rent. When you look at the rent around Oromocto and around Fredericton, and then you transfer that to the smaller communities where they're trying to compete and keep the people living. I mean, a lot of people are paying over $1,500 a month in rent. And if you are a single mother with child tax benefit for 3 kids on income assistance, your income is about $2,100 a month net. So when you're paying $1,800 of that, $1,500 or $1,800 of that out to rent, it doesn't leave you very much for anything else. Especially if your power is not included in that money. And in a lot of cases in rural communities, wherever they may be, they're older buildings and they're not well insulated and the windows aren't great and the power just goes out the window. So we're challenged with all these various kind of pressures that are being put on people that are forcing them to come to the food banks. And we're happy to have them if we can help them. You know, during the pandemic, we were considered an essential service. We went to work every single day and we fed people every single day. So now we're at a point where we have to look at what we're feeding them and is it helping? And so we've taken care of the school programs. We've increased our contributions to the schools significantly. We provide well over 400 lunches a week, bag lunches to 12 schools in the zone that we're working in. And we're kind of out to the Cambridge Narrows and Junction and all around. We deliver food to all of those places once a week. And those bag lunches consist of a sandwich and a piece of fruit. I just said sandwich, the way my mother did, sandwich. Sandwich and a piece of fruit and usually a granola bar or a gummy packet or something like that, so that the kids are getting something to eat and enough to fill their belly at lunchtime. We're part of the provincial and federal breakfast program. We act as a hub for that program in our area as well, where we're provided with what the school has requested for breakfast food. And we deliver that to the schools every 2 weeks. So there's a lot of delivering going on, a lot of driving going on and things like that. So what we've decided to do is we've decided to take some of this food and some of this ingenuity and the equipment that we have in the kitchen that was all mostly gifted to us through grants and things like that, and turn it into meals for families. So we have about 500 families a month come in. So the kitchen staff that we're working with, one staff and the rest volunteers, are making at least 500 meals a month and at least 500 liters of homemade soup a month. And those are going into the freezer unit that you supplied, and they're being handed out to the clients, usually one of each. If we have 500 of both, we're giving them one of each every time they come, once a month when they come through the door. And as that becomes more popular, and as we'll be asking for feedback and things like that from the clients, it will provide. Yesterday, Jamie made turkey dinners, so she cooked 5 or 6 crown turkeys and potatoes and vegetables, and she put them in one of these trays, like the black trays you see in the grocery stores. With a little gravy on the top, and heat sealed it and froze them, and so there's enough turkey dinner in that packet for 2 people, 2 adults, easily enough for 2 adults, or there's plenty there for 1 adult and a couple of kids. And as the families are larger that come in, we would give them more. Once we get it on rolling and figure out what people's needs are, we will provide them with more. And the hope is that and we put out a plea. We're having our website revamped, and we've put out a plea for more volunteers for that program. Not necessarily to cook, but to package, to dish out, to do whatever has to be done, and to deliver. Because again, that's another process of the delivery. So we take food, we deliver food, and I'm being aware of the region that you are serving, is that we are taking food to all of the food banks in the area. Like, so we give food to Fredericton, Salvation Army. We provide Macadam, and I know they're not in your area, but Harvey is designated to that food. So we provide food there. We're out at the Village of Hope in Tracy. We're providing food out there. Fredericton Junction, Hoyt, Whirl, Enniskillen, all those places all around that whole circle, to the border of Nasonworth almost. And and to the border of Majorville and out to Cambridge Narrows and Gemseg and all those food banks. So we started out a lot smaller, but the Gemseg Food Bank closed down about 6 years ago, and we took over their clientele, and so the Gagetown School is part of our area, and all of those places around. So we are very busy looking after families and kids, and particularly children in the school program. So, you know, I just don't believe any kid should be hungry. The other program we offer for them is an eggs in school program as well. So we're cooking on Sundays. We cook right now. We're up to 450 eggs, cook, hard boil, peel, pack, and they're part of the Monday morning deliveries as well. So on every Monday morning, we go out with backpacks, eggs, and bag lunches. And every Wednesday morning, we go out with bag lunches and hot soup for the high school. So so we're very busy in our little corner of the world, looking after all these places, and I think that that explains to you why I needed the money. I'd be happy to kind of talk some more on anything that you have a question about.
Thank you, Jane.
Somebody asked a question. Yeah.
Do we have any questions for Jane?
Mr. Chair, if it's all right, I don't know if any of the members do, but I wouldn't mind throwing one out there to her, if that's okay, sir.
Sure.
So Mr. Chair, through you to Jane, Jane, in terms of that, how do you interact with the other food banks? Like you're like a food distribution hub, really. There's a lot of times when some of the big retailers will call you, they'll say, hey, we've got 6, 7, 8 pallets of food. That was one of the things that really spurred the conversation.
Yeah,
with
yeah.
The loss of product that
Right.
because the other vehicle wasn't reliable.
Right.
There was issues in transportation and stuff. I'll just get you to maybe.
Yeah, so we do act as a bit of a hub. Today would have been a good day for me to do a video out there for you and bring it in.
Yeah.
I had 5 food banks come this morning and pick up food from us. So we get food every day from Costco, produce that is not sellable anymore, and other products as well, and meat and their dinners, like so shepherd's pie and all those things that they sell in Costco. And when the meat comes, it comes in giant portions, as any of you who shop there know that. And we break that down. The giant things that are frozen when they come that we can't break down, we cook those and they become part of that meal program. And then the things that we can break down, we make them manageable into family servings. And they get frozen, repackaged in Ziploc bags and get frozen, and they go out to the clients. If our truck isn't working and we can't go to Costco to get that food, there's a very good chance that it's going to end up in the landfill, because we are the designated food bank that picks up that food. And we have until 12 o'clock in the day to get there to get it. If we're not there by 12, it disappears. That's just the way it's set up. That's the arrangement that we have. We are also, through a company called Second Harvest, the designate for the Sobeys warehouse, the distribution warehouse in Oromocto, where we receive humongous amounts of food, especially since Christmas. Sobeys is expanding and building a new piece on their warehouse down there. So they're moving stuff around quite frequently. So for instance, at 1 o'clock today, I will have 9 new pallets of food in the yard. And next week, they've already told me they'll be up to 20. And I get those. I do not have enough space to store all that food, because we are begging the world for a warehouse. We're ground ready to build it. We just need the money. And we're begging every political person to get the money. But in the meanwhile, what happens is we deliver that food to other food banks in the region. We go to Stanley every month with food. We deliver food to various organizations in Fredericton, the Multicultural Association, French Multicultural Association, which is known as CAFI, who work out of the École Sainte-Anne building. We have a couple of churches that we provide for that run little kind of food banks in their basement, and and things like that. And there's an under the tent program in Fredericton that comes every week and loads up a vehicle and takes things to put together packages for the homeless people downtown. And so where our hands are in everywhere, and without the safety and you know, that good feeling of driving a vehicle that isn't gonna fall apart halfway to where you're going. We were very skeptical about continuing to do all that stuff. So we have food banks that come to us and we have food banks that deliver. And when we get an amount of food, we have 7 sea cans on site that we pay rent for. And that rent comes to almost $62,000 a year for the 7 sea cans, and they're all full. And we move the stuff in and out as much as we can to keep that all going. So it's for a small little community town of Oromocto, we are a pretty big operation. We serve about 500 families a month, once a month, and of those 500, I would say there maybe 20 or 25 would come twice. When they come, they get probably 7 to 10 days worth of food. They get dry food, cans and boxes and pastas and things like that. And then they get another box with frozen and produce. They get, you know, French fries and hot dogs, and then they get meat based on what has come in and things like that. So we're pretty proud of what we're able to provide for our clients, and they don't, like 20 or 25 coming back twice means that we've given them a sufficient amount of food to kind of enhance their monthly food intake. You know, we tell them we're there to enhance what you can buy. We're not there to provide you with all your monthly food. So, you know, those are all things that we do as well on top of the school programs and things like that. And then we do fundraising, and we offer a community food smart program to the community, which allows people to come in and pay $20 for a bag of produce that we buy in bulk. Which is usually worth between $40 and $50 in the grocery store. We do that once a month, and the food bank doesn't make any profit off that. We buy what we have the money to buy, and the community members do that. Some community members donate an extra 20 so we can give one to a client and things like that. But that's kind of a whole separate program in there. We're part of a 4 or 5 club Chase the Ace program right now that runs out of Gary and Oromocto and the Legion, and I forget. I forget what the 5 clubs are. I'm on the spot.
It's quite a lot, Gene.
Yeah, it is quite a lot, and so this is the 3rd Chase the Ace, and we've done pretty good on the previous 2. So, and we're up to 23,000 this week, I think. So, you know, that's a good program to have. So all of this takes people, all of it takes volunteers, all of it takes gas, all of it takes, you know, time. We're there 7 days a week. You know, I have one person who kind of runs all these sub programs out of the kitchen, and she's there 7 days a week in the mornings. So that we're covered for people to donate as well. And yeah, it's a lot.
Okay, super. Thank you very much, Gene.
We have another question down here.
Is it okay? Real quick question. Okay, Tim.
Yep. Thank you. I'm just wondering, like, with your reach being so broad, and especially out into the rural areas, I'm wondering if you have any insight into, like, are you seeing, given the current state of affairs, more families at risk of homelessness, more individuals at risk of homelessness in those rural communities?
Yes,
That
we are.
probably
Yeah.
don't see.
Yes, we definitely are. Yeah,
Okay.
because of the rents.
Yes.
Yeah, because of the rents mostly.
Yeah.
Yeah.
Okay. Thank you.
Okay, thank you. Any
I have a
other
question.
super quick questions?
Yes, I do. Greg speaking. I'm overwhelmed with the operational, you know, tidal wave of information and so on and so forth. And thank you very much for taking time
Thank you.
out of your busy schedule to come in. I think one of the ways that we might be able to help is not by making operational suggestions, and you are the experts in that. But you know, typically, you know, this organization and the municipal organization it plugs into work best through policy documents like strategic plans and things like that. So I guess my question to you is like, do you have a strategic plan that you can share with us so that we can start to plan and predict how we can help you in the future?
Yeah, I do have one.
Awesome.
I will get that to you.
Excellent, because the city's found it City of Fredericton's found it very helpful when we're interfacing with organizations in the community to be able to look at a strategic plan and like a spend analysis to go, okay, here's an area where we can help.
Mhm.
Things that may not be operationally obvious, but are helpful as well. And we all
Sure, yeah.
want to see you succeed. Absolutely.
Appreciate it. Yeah,
Okay,
thank you.
thanks again, Jane. So we'll move on to ESIC and the CRSC projects update. We'll call on Lise to do this, please.
Mr. Chair, if I may, just before Lise gets started, I don't mean to be rude, Lise, sorry. Jane, you are more than welcome to stay for the rest of the meeting and watch the operations of it. But also, we usually, if guests would have other commitments or anything that you feel that you need to get to, feel free to exit at any time.
So what
We're
I'm
not-
gonna do on that is I will be outside at 1 o'clock and I'll go do that delivery. Okay, thank you.
Thank you.
Thank you. I'm taking this with me.
Yes. thank
Oh,
you.
yeah, I got a couple extra cookies, so I'm good.
Okay, thanks, John. And Jane,
Oh.
Thank you.
okay, go ahead, Lise.
Thank you, Mr. Chair. So I'm not going to go through the 2025 part of the status update unless anybody has questions. I'm going to start with the 2026 planned upcoming projects that are coming up. We've completed most of 2025, except a few things like a faith-based organization get together, as well as we'd like to invite the Chipman Minto folks who are experts in settlement to come and give a presentation to other communities. So that may happen, spring, summer. So that is on the back burner for right now. We've got so many other things to plan, but it's still on there. We still have the budget money left for that. So the first thing is, of course, we're going to take on the cost of the administration of the Resiliency Network meeting. So last year, basically, it was mostly JPS that took the cost of that. But because it is also our commission network, that network is equally used by myself and by Carrie. This year, we're going to take on the cost of holding those monthly meetings. So basically, it's just renting a rec center and bringing in lunch. It's not a huge amount. It's more like $6,000. But that is one of the things that we're taking on as part of our budget. Another thing that I really think would be useful, and the more I think about it, the more I speak to people, I think it would be very practical to do this, is to travel to each community and meet with the CAO for that community. And I would like to bring also Carrie as my co-chair in resiliency, or some of our Horizon Community Development or our Horizon Health folks, because they have an idea what's going on in all of our region. And I think it's best to go for a one-on-one meeting with the CAOs. If they want to invite their mayor, if they want to invite some councillors, whoever they want to invite to that meeting, and let us know. We're going to have a prepared set of questions to ask them to just get the discussion going. But of course, we're going to open up the discussion for them to discuss anything that they feel is important to them. If they have questions about PRAC or about land planning and all this stuff, I'll take notes and I'll bring them to Lonnie or whoever else, because sometimes that happens. We'll get questions about the landfill just because we're from the commission. And I'm certainly, I'm good at communicating that with some of my coworkers, but the aim is to talk about community development and social inclusion. We'll be hosting at least 4 financial literacy workshops in various areas of our region. And of course, you know that this is related to the poverty file directly. And I've even applied as the commission for ESIC funding. So if I do get the money to replenish the cost of holding these clinics, that'll free up money to do more grants or more funding of other events. And so we've already scheduled one March 9th in Willamuktuk First Nation, following a meeting with the chief and council there. And the audience is basically, it's an Indigenous lens. It's really all people from Willamuktuk, Sitansis, and Village. And we're in the process of filling that room right now. The next one will be with a group of women's groups. So in other words, there are a lot of groups in part of our network that are working on violence against women or women's rights or things like this. And so we're trying to sort of hone in on some of the themes or some of the specialty groups that fall under poverty. And that will be the next one. Another one will be students and international students, because we've found that they're having a really hard time paying the food bills, and they're having a really hard time as well juggling everything, paying for their tuition, paying for their rent. So as we find out about different groups through our network, we're kind of going in and asking, would you like us to put on a financial literacy clinic? So we'll start that way. And then if there's funding left, then we'll go to different areas who've not hosted us. We'll be hosting 4 stigma reduction clinics or workshops in various areas of our region as well as 4 speed networking events in rural areas. We're going to try 1 or 2. If a success, if enough people show an interest, we're going to have more. But really, the first one will gauge whether, either where we're going to have it next or whether we are going to have it next. And if not, we'll put our funding somewhere where it'll be more adequately used. We will be promoting the Community Food Smart program. Sandy McKinnon of GFSI is looking after that. And they are finding that more people could know about this. Here in Fredericton, the food bags are only $15. But the problem is they've got plenty of people packing the bags once a month in one of the churches. What they're struggling with is finding people to deliver the bags, or just promoting it, letting churches know that if you can just name somebody to come and get one of these food bags, if you have a volunteer, they can come and get 12 bags for your church, and then your people can go to church, pick up their bags there. So more promotion that way. Another one that is of interest, I know, to Director Forsyth is we're going to be hosting 1 or several grant writing workshops. There's already an interest. There are about 10 people, I believe, from Director Forsyth's area that are interested in attending one of these. And we're going to try to change it up a little bit. The last time was quite high level, and it was a full day of that and other classes with KPMG. We're going to try to bring it down to a more basic level. And we're going to use our own grant applications as an example. For example, when you're applying for a resiliency grant, when you're applying for an ESIC grant, when you're applying for a City of Fredericton grant, we're some very practical examples. We're going to continue to work on the Capital Region Food Council. We just held a meeting not too long ago, and of course we're going to that's coming around, the actual formation of that, and I'll get Carrie to speak to that when she speaks a little later. She's more the expert on that, but it's coming around. We've got good representation around the table, and community developers and food experts, agriculture experts, and also school food projects. There are already committees looking after that, and we're always invited to those meetings just to keep up on those projects and to ensure that our local schools have access to those. And as you'll remember, last year, a lot of our schools, as part of an ESIC grant, received equipment such as refrigeration equipment, toasters, and other kitchen equipment to be able to support these programs. Because not all schools have cafeterias or fridges. And we're applying to do the same in our Francophone schools this year. That was one of the ESIC grants. So we're just waiting to find out whether we were approved, but it looks very good for approval of that. Continue to work on Indigenous relationship building in collaboration with GFSI. To date, we've had 3 meetings. The last one was in Willamuktuk First Nation, a very, very successful meeting. They were very interested in some of our projects, for example, anything related to youth and the skilled trades. We had some good discussions there, and they're the ones that came to me and said, we'd really like a financial literacy clinic. And so, yes, the next day it was planned. So that's going ahead. We'll be working in the coming year, and this is more vague, but as to how we're going to be doing this. But as you know, there were various studies this year for transportation synergies and physician recruitment. So as those programs roll out, I'll be assisting and attending meetings to see how community development can assist. Continued work and promotion of urban rural rides. I'm often asked to go, put in a kiosk or to speak to a group of people, and I always bring my 211 forms, and I always bring my urban rural rides forms, Nursing Homes Without Walls. There's always a set of pamphlets that I bring with me, but that is something that we always are there to provide information on. Continued collaboration with Ignite and CRIN, the Capital Region Integration Network, as well as Jobs Unlimited and the United Way. I'm on committees and boards of directors for various organizations there. So that lets us keep, I guess, keep an eye open for things that are happening there in terms of funding, in terms of new projects coming out, or even issues that may be happening. Continued monthly meetings and collaboration with Gwen McIntyre from the City of Fredericton's Community Inclusion Office. That has been such an excellent sharing exercise every month. We look forward to meeting with each other, Gwen and I, and then we run into each other at CRIN meetings and other meetings with GFSI. So we have a lot in common in our work. Coordination and collaboration of moving forward together clinics and super clinics, matching our most vulnerable people to services and funding. Now, I don't know if any of you, if all of you have heard about these, but these are amazing clinics, mostly hosted by Service Canada, but we act as a coordinator and all the SIN coordinators are getting involved in these. So basically we'll go to a church and there will be tables set up. There will be people from the church doing income tax returns for free. And they'll be even doing several years of tax returns. So if you haven't done your taxes in 10 years, they'll help you with that as well. Because by doing your taxes, you're opening access to all kinds of programs. But then there are people from other organizations such as NB Housing, mental health, Indigenous affairs. We have public health nurses there to give vaccines. We have Service NB, various important people, so that when a person, the people that come to these clinics are either in our shelters or living in extreme poverty or living in the streets. And those are especially for those folks to come in. And just by getting your income taxes done, you're getting more services. By going in and getting cards, for example, your Medicare card, so you can get your teeth done, things like that. There are people at that meeting, they'll do it on the spot. And it's been very, very successful, and it feels good. It feels really good to know that you're directly helping those folks. There's also something similar that we're involved in through ESIC, and it's the super clinics. It's the same idea, but it's focused on mostly for tax returns and a few of those partners, but not as many partners. And it's for anybody who is struggling, to make ends meet, who wants some help preparing their taxes, maybe not at the same level of poverty. Can we continue to promote 211-988 Void Alert in our region? Continue relationship building and awareness building with our Francophone population and other cultures through MCAF and Ignite. At our last resiliency meeting, I believe there were 7 partners from MCAF. So that's always wonderful. They represent different parts of MCAF, but fascinating projects that are going on there. And then continued collaboration with the Community Action Group on Housing and Homelessness and other housing committees. Those ones are often timed at the same time as our resiliency meetings, but through my work with GFSI, Jason Lejeune came and gave a presentation to the GFSI Stewardship Board, and it was absolutely mind-blowing. I learned so much from his presentation. One of the #1 things is that a high percentage of the people living in homeless in Fredericton are Indigenous. I believe it was something over 60%. And so things like this, they're very important when it comes to our decision making, when it comes to deciding what projects we're going to take on next and where we'll be putting our grant money. So I don't know if you have any questions regarding this or some of our 2025 projects or anything else in the future.
Okay, any questions for Lise? You've done too good a job, I guess, Lise.
Thank you. Thanks.
Okay. Thank you very much. Very informative. We'll now call on Carrie. She'll do the Capital Region Resiliency Network update.
Thank you. Hi, everybody. Good to see you all. Lee's covered a lot of ground, so I'll start with a bit of a high level of what our intentions are for the upcoming year. As you may be aware, Lise and I hosted our grant intake together for 2026. So we did an open call through the Capital Region Resiliency Network around funding that may be available and led a group of really community-led organizations, that diverse group that's at our network meeting, through opportunities for funding. We had, I think, over 27 applications come through, and we've been able to navigate areas of funding that we would either fit between resiliency funding, ESIC funding, and other funding opportunities that are out there. Part of the package, and thank you for circulating, Kelly, this morning, was the recap or the communications that we've sent to the distribution list. And I just wanted to more or less include that moving forward so that you guys are aware of what's happening at the network level. Lee's referenced this earlier, but how the structure is working for the Resiliency Network is that we meet monthly. We're hosting it in different areas of the region, and we're getting around 35 to 40 people in attendance once a month. And I would say that the trick or the challenge of this network meeting is that you have folks that have been there since its inception, and then you have folks that are joining new every time. And the gift of that is that we have new perspectives coming constantly, and we're constantly learning about the gifts that are in each of our communities and our region. So just to recap our January meeting, we were at where were we? We were at the Bilgic Training Center, and very interesting opportunity, I think, and felt so much trust being built there. They had a loss in their community and shared with us some of their cultural practices in terms of the sacred fire. Many folks that were joining there today had never visited, so it offered the opportunity to come in and build trust amongst this community as well, and offered an opportunity to learn about what the offerings are in terms of the sacred fire. So we had a total of 14 members in attendance in person, and we had 21 partners join us online, so a total of 35 participants across the region. We went through a bit of a recap, and this is a practice that we do at every meeting. So I know Director Duplessis has sat in. I believe there's been others around the table that have sat in at some of our meetings. We start the first meeting off, the first part of the meeting, just doing a recap of like, how the heck did I get looped into this network meeting, and what do I need to know about being here? So it talks about our alignment with ESIC, with the Regional Service Commission, and really the goal is just to set the stage to say this is really a sharing circle of information in our region. The next part is really where we mine the really good information out of the community. So we host a regional roundtable for an hour. And ultimately what that means is I pose the question, how are you connected to the region, either personally or professionally, and do you have events or things that you need support from? So it's about an hour and 15 minutes of going around table in the room, hearing what's happening in the region. And this has been feedback we've received, is that it's really where people find the time most beneficial, because there's so much happening, and how do we track some of those pieces? What we've been working on in the next part, really that hour session before we head into lunch, is how do we collectively start to work together on areas of importance in our region? So in the January meeting, we talked through, we say we're really trying to measure impact, but what does that actually mean? So we talked through the differences between what activities are, what outputs are, what the inputs are, and how we might start to measure that impact if we are truly collaborating on some of these bigger tickets like food security and housing, mental health, things like that. So I think it's just more of an awareness exercise. But what we're working on with our regional team, which would be Lise and myself, we've got support from Katie as well. We also have Louise Lockhartz, who's with the Chief Medical Officer of Health, and our Horizon Health community developers, along with the networks and associations that we bring. We're meeting at the beginning of every month to plan out what that network meeting will be, because then that gives us an opportunity to connect grassroots with community and help make sure that they get the information they need at the right time. So we have a pretty hearty agenda coming up for February, but the goal is that it's not just myself up there sharing for 6 hours. We're able to really leverage how do we engage community without over-engaging community, which is always the fine line. So basically we're offering, an hour and a half window once a month for partners to come in and hear from community stakeholders which is a fairly diverse group at that table, to say, okay, Horizon, if you're looking to engage in community, here's your opportunity. For example, we have Louise joining us in February, and she's going to look at like, what does health impact actually look like, and do a bit more of like, how do we start to measure some of those pieces, or what does that look like? So we're giving her the stage to be able to help her in some of the work, but also it benefits our residents in the region, who's able to get a better understanding overall what this looks like. The next part of the meeting is from 12 to 1, and it's really a networking lunch. So from the community roundtable, you may want to follow up on a couple of leads or connections. You've got a project on the go. It offers that space for community to make those natural connections in a given time. And typically what we're starting with for February is that the space that we're in, so in February, we'll be out in the Hanwell at the St. James Presbyterian Church. They're going to come and speak to us during the lunch and share a little bit about what they do for services. So it helps to improve some of the awareness of what's happening across the region. And then in the afternoon, we're lining up guest speakers so that are relevant. So we do have... oh, my mind is escaping me right now. For our February lineup, we have Elections NB. And so Patty Nason is coming out again. And I'll have to, Big Brothers and Big Sisters are coming to speak. So that's the Fredericton or Oromocto area. So a bit more about what some of their programs and offerings are. So it's a chance for us to learn more about what's happening in and around the region. So we really see this network space as an opportunity to become more aware of what's happening, but also offering time and space for us to start collaborating on some really important issues. Where I see an opportunity at this table is that should this table see an area or impact we want to measure, we can align the work that Lise has done and help to create with the work that the directors have put forward here. So we have that space to engage in community should we want it or need it or want to leverage it further. So that's kind of a bit overview of where we're really hoping to take the network this year. Ultimately, back to the role of justice and public safety is that we want to really make sure that community emergency preparedness is at the table. So this is basically a communication system that's been established so that when I'm working closely with our regional emergency management coordinator, Dan DeCleva, I can help to inform and say, you know what, have we thought about this homeless population, or have we thought about the impacts of a food bank flooding? Should this ever happen? And how do we get community more prepared? Because we know that climate reality is here. We saw a really hard summer this past year. We saw some really cold temperatures a few weeks ago. How do we help to inform that emergency response? And that's really the role of what all of our our regional resiliency coordinators are across the province, is to help inform where those vulnerabilities are seen. So all that to say, we do have a distribution list process that we've done a new re-intake because we had over 400 members on our distribution list. A lot of people change jobs and roles and all those things. So we've come up with a new system to make sure we have people register to be on the distribution list. So I can circulate that, but that's also in the material that Kelly circulated this morning. So we're encouraging everybody to register to be part of like a network of this free network membership, and that puts you on the distribution list. So I encourage you all to circulate that far and wide. That's where we'll send these monthly updates in terms of what's happening at the Resiliency Network table. And it's where we'll send any other resources that come. For instance, we're looking to have more of like the events and stuff that we can share. Lee's referenced a couple of the tax clinics and such. And just as a stat to follow up with, there was almost $80 million returned to lower income New Brunswickers through the Canadian Volunteer Income Tax Program last year. So would just want to flag the date for the upcoming super clinic that's happening in the Fredericton area is March 24th. We're looking for volunteers that could potentially have an interest in helping to file for this for taxes. Ultimately, the goal is that that's the only central one that's here in our region, but we're hoping that regionally we can help to connect those that may need further supports to this clinic that's happening in March. And that was from Louise Lockhart, who's the Senior Program Advisor for the Chief Medical Officer of Health. So we're harvesting a lot of really great community information. my goal, and I think our network's goal, is that how do we really tap into this and make it work so that we can use this information in regional efforts. And I'll open up if there's any questions, Director.
Okay, thanks, Carrie. Very informative. And I'm very happy to see that someone from Elections New Brunswick will be on at the next meeting. And I know Director Erickson brought that up. And I think there's a virtual meeting from the city, is there, Director Erickson, coming up for election for?
There's a whole week of events scheduled, and it starts this coming Monday night or Tuesday night, I believe, yeah.
Okay, great. And anyone can tap into that, right?
Yeah, absolutely. They have to register with the city clerk's office, but you know, it's available for members of the public.
Okay. Yeah, thanks again, Carrie. And do we have questions for Carrie? Yes.
Okay. I'm just wondering, especially for like the super clinic, are you tapping into like the shelters and those providers to ensure that their clients are being directed to that?
That is through you, Mr. Chair. That is exactly how it works. It's the people from those shelters that bring them in, but also they also supervise in case something should happen, either a fight or a conflict or whatever. So yeah, they're the ones coming in. So they sit in the seats and basically wait for them to go from kiosk to kiosk. And they've been so helpful. You know, anybody who comes in from the shelters and brings them in, they often drive them there as well. And sometimes what they've done is they'll have something going on in another part of the church at the same time. So they can come to our clinic and then they can also go to this workshop. I've noticed there's a few things like that going on concurrently. So yeah, we've got excellent help from the shelters on that.
Thank you.
Okay. Any other questions? Seeing none. Thanks again, Carrie. Very informative. So now we'll call on our CEO, John Smith, for Human Development Council Mapping Project.
Yeah, thank you very much, Mr. Chair, and through you to the members. This an information item. It was kind of done a little bit in the reverse order. I apologize at the last board meeting, and I'll apologize to the committee. And the reason was we filled in an application. We became aware of the opportunity with the Human Development Council in the capital region, what their focus of area was and what our focus of area was. And one of the things that we were looking at, along with, as you'll see in here, in terms of data servicing and mapping, strengthening partnership, and improving regional outcomes, is they were looking at the propensity and the vulnerability as to what Member Fox had talked about earlier with Jane Buckley from the food banks, is that that what does that look like in the homelessness, especially in the rural areas, and what does that intersect look like when coming into the urban centers? And so this is a short-term project. It has to be completed by the end of March. And we partnered, and we thank the Human Development Council for that partnership in that. And so really what we're doing is a survey with CAOs, clerks, mayors, officials in the communities, and those are underway now. They've already been to Hanwell. I believe, Dr. Bosch, you've been into that, or in terms of that conversation yet, and just yesterday. And more are being scheduled, and more outreach will be happening over the next week to 2 weeks. And hopefully that will happen. And then they'll be meeting with the folks from the city and the town, city of Fredericton, town of Oromocto, and talk about what they're finding, what they're hearing, and see how that intersects in. And a report will be filed back with this committee, probably sometime in April, May at the latest. And so we'll have a sense of where we're going with this and what that need is. And where it was born out of, Mr. Chair, was we get a number of phone calls every day when people are they're finding it hard to navigate the provincial and federal systems, whether they call 211 or whether they call directly to a client-based organization. So this was really born out of a conversation around navigation of the system, and it plays exactly into what Carrie and Lise are trying to do in their roles, how that works in resiliency, how that works through community development, how that all comes together. So we'll be able to see what the data tells us and how we bring that forward. And it also plays very much into the scope of what our strategic value to the commission is and to our members. And that's through regional planning, data-driven decision-making, and addressing vulnerable populations. So, and this is also an opportunity to strengthen that interagency relationship. And so a lot of this will come back. And when we have that information, we'll be having those conversations with Leeds and Carrie primarily, and bringing that forward to the committee for the information. And then we'll see where it leads from there. The council was very interested to see what that would look like in the capital region, and then what would be those next steps be. So whether that leads to a navigational role, whether that leads to some possible funding for resiliency and community development, we don't know what that will look like, but we'll have those options sorted out and once we have the report completed. And this is, Mr. Chair, is an information report, so it does not require a recommendation to the board at this point in time.
Okay, thank you, John. Do we have any questions for John? Yes, Tim.
Yeah, so I guess not so much as a question, but I think maybe some suggestion.
Yeah.
When Jane was talking here today, I think it would be great to have the consultant working on this report talk to Jane.
Yes.
About being able to, because Jane has feelers out in those rural communities. It's why I asked the question that I did, to be honest, of Jane. Because I feel as though, it's difficult often if you're just meeting with the CAOs, they have limited understanding of what's happening out beyond kind of out there, right?
Yeah.
That's right. And so, if there's a way to talk to some of the service providers in those communities, I think that would be good. A lot of the communities don't have service providers. But this is where, people like Jane are invaluable, because Jane she does have feelers out, especially in those rural communities where maybe nobody else knows what's happening. So I think it would be really valuable to have Ed talk to her.
Yeah, absolutely. We'll point them in that direction.
Okay, Director Erickson, did you have a question?
I do. Thank you, Mr. Chair. So I'm curious if this kind of regional analysis is going to be happening at the other service commissions as well. Because eventually, these things could all be knitted together into quite an excellent coverage of this topic to be shared with the province.
And thank you very much for you, Mr. Chair, to Director Erickson. When we started this conversation, again, it was born out of a need for what does that navigational role look like in and around in the rural areas? What's the intersect with the city? I understand from colleagues in other community or other RSCs that they are working in kind of a needs-based in their area, in the particular area. The council did mention that they work very well together with the city and with the town of Oromocto, and that there is information there that is known. It's trying to figure out how that other information feeds into that. Certainly something that's been on discussion, Director Erickson, we've had that conversation at the CEO table with the RSCs, and we've all been talking about that. So they're starting to see, now that we're getting a little bit more mature in the organizations from the new mandates, you start to see that more synergies of working together on that. But I'll certainly raise that with the others as well to find out exactly how many had been using that service. But they were open to it, and they were very thrilled that we were able to take this project on for them.
Right. And I'd just like to suggest too that they plug into the community action group on homelessness. They've just been operating for decades now.
Exactly.
Across all levels of government, depth of experience that will keep those consultants busy writing and typing for quite some time.
Okay. Lorraine, you had a question?
Just a further comment on what Tim was saying about reaching out to Jane. She just touched on what she was responding to it in the money. When you're talking about the income tax for the people who need it, she does that from the food bank as well. Like, there is so much going on that it just, People have no idea. I say that every day when I hear about the food bank. I say, you have no idea what's wrong unless you go in there, and you have to stay there and see, because it's not just the food. It's fulfilling the needs of those people.
Yeah.
As you can tell, I'm very passionate about it.
Thank you, Lorraine. There's a whole different world out there and
Yes,
avenue
yes.
we don't even see. Any other questions on John's report or any additions of directions to staff at this point, or?
Mr. Chair, if I may, if anyone has any other suggestions, please just feel free to email me and reach out. I think everyone's got my coordinates, and if not, they definitely have Kelly's. So.
Okay, thanks. So if there's no other questions, if I can have a motion for adjournment, we're pretty much right on time. Moved by Lorraine, seconded by Tim. All those in favor?
Aye.
Motion carried. Thank you very much. Take care, everyone.
Thank you.
Thank you, everybody.